Our next abstract is going to be from Dr. Alka Khaitan. Dr. Khaitan is presenting children who are HIV-exposed and uninfected exhibit immune suppressive plasma biomarker profiles. Dr. Khaitan is from the Indiana University School of Medicine in the United States, and we will now turn it to her.
Thank you to the organizers for inviting us to present our data. Nearly 15 million children are living globally who were exposed to HIV yet uninfected, referred to as HEU. A number of studies demonstrate that HEU have higher morbidity and mortality than HIV unexposed counterparts, or HU. In children with perinatal HIV infection, chronic immune activation lies at the heart of long-term morbidity. Interestingly, HEU also exhibit immune activation despite a negative HIV status. They exhibit a pro-inflammatory cytokine profile and T-cell activation in early infancy. However, it is unclear whether these immune perturbations persist through childhood. We evaluated plasma biomarkers in toddler-age children who were HEU or HU. This study was a cross-sectional pilot study nested within the project, assessing neurodevelopmental delays in children born to HIV-infected mothers in Western Kenya, a pilot study led by Drs. Megan McHenry and Aaron Oyungu. The setting was the academic model for providing access to healthcare, or AMPATH, in Western Kenya. Children who were HEU or HU between the ages of 18 to 36 months old were enrolled between December 2017 and September 2019. Plasma samples were collected and cryopreserved in Kenya and shipped to Indiana University for analysis. A total of 82 participants from the parent study had adequate plasma samples for our study. This included 44 HEU and 38 HU. The median age for HEU and HU was 22 and 24 months respectively. This was a statistically significant difference, which we accounted for in our multivariate analysis. Sex was matched between groups with 19 males in each group. We measured 81 plasma biomarkers using magnetic bead-based multiplex platforms. We used two kits, the 65-plex human Procarda-plex kit by Invitrogen and the human immuno-oncology checkpoint protein panel kit by Millipore Sigma. The biomarkers included in our panels are shown here. There were 24 pro-inflammatory cytokines, 18 chemokines, 11 growth factors, 3 markers of endothelial activation, and 8 inhibitory and 8 stimulatory soluble immune checkpoints. Of the 81 plasma biomarkers that we measured, 14 were significantly different between children who were HEU versus HU. Those that were lower in HEU compared to HU are highlighted blue, and those that were higher in HEU are highlighted red. These are the 12 biomarkers that were lower in HEU compared to HU, shown here with median values and interquartile ranges. They include 5 chemokines, 2 growth factors, and 5 pro-inflammatory cytokines. IL-12 and TWEAK were the most significant of these biomarkers. Notably, IL-12 is a Th1-inducing pro-inflammatory cytokine that is produced by activated macrophages and dendritic cells. It stimulates interferon gamma production by T cells and NK cells. TWEAK, or TNF-like weak inducer of apoptosis, is a cytokine in the tumor necrosis factor superfamily. Of the soluble immune checkpoints, 2 inhibitory checkpoints were higher in HEU compared to HU, namely CD40 and TIM3. Soluble CD40 exerts immunosuppressive effects through negatively modulating CD40-CD40 ligand interactions. In vitro studies demonstrate that soluble CD40 suppresses IL-12 production by APCs. TIM3 is a key inhibitory immune checkpoint that has been associated with T-cell exhaustion during HIV. Soluble TIM3 levels correlate with surface expression of TIM3 on CD8 T cells and also with HIV disease progression. Finally, we performed a multivariate analysis to account for potential confounding effects between biomarkers. We applied a Bayesian model averaging, or BMA method, that accounts for uncertainty in our model selection. In our analysis, we included age and 20 biomarkers that differed between HEU and HU, with a p-value of less than 0.1 as variables. The outcome measure was HEU versus HU status. Thus, in the BMA analysis, a total of 2 to the 21 models were considered. Our results showed only 3 significant variables: IL-12, CD40, and IL-13. The PEP value, or posterior effect probability, shown in this table indicates the strength of evidence that a variable determines HEU versus HU status. A PEP score of 0.5 to 0.75 shows weak evidence, 0.75 to 0.95 positive, and greater than 0.95 very strong evidence. The strongest variable in our BMA was IL-12, which is similar to our univariate analysis. In conclusion, HEU had lower levels of 12 pro-inflammatory cytokines, chemokines, and growth factors. HEU had higher levels of inhibitory soluble immune checkpoints, CD40 and TIM3. In our multivariate analysis, IL-12 was the most significant biomarker that predicts HEU versus HU status. Overall, our data shows that toddlers who are HEU exhibit an immune-suppressive plasma biomarker profile compared to HU, which is really contrary to early infancy, in which HEU exhibit immune activation. I'll close by acknowledging my co-authors, the AMPATH team that enrolled all our subjects, and of course our study participants. Thank you for your time, and I welcome any questions.